Hi, my name is Emily Waller, and I am an occupational health specialist for the Arkansas Department of Health. And today I'm going to be talking to you all at the Little Rock Air Force Base about your exposure to jet fuel fumes and exhaust. This is an outline of what we're going to be talking about today. First, we're going to talk about what makes up jet fuel fumes and exhaust, the chemicals, and then we're going to talk about what your exposure is, and then follow that up with the short-term consequences of exposure and then the long-term consequences of exposure. And then finally, after I've scared you a little bit, I'm going to talk about how you can limit your exposure and protect yourselves. So first up, we're going to talk about what's in jet fuel fumes and exhaust. So currently, the U.S. Air Force uses jet propellant type 8 fuel, JP8. This was a recent change, as in the 90s, away from diesel fuel because of the health risks. So jet propellant type 8 is used in all Air Force vehicles, including any of the military vehicles and auxiliary ground equipment, so not just planes. And it's expected that we will continue to use this kind of fuel until at least 2025. So JP8 is kerosene-based instead of diesel, and so it's a mixture of aliphatic and aromatic hydrocarbons such as benzene and naphthalene, and it's less volatile than standard diesel fuel. So whenever your plane gets hit, it's less likely to explode when the fuel tanks get damaged, and that's great for the Air Force, but one of the downsides to that, it means that it will remain on surfaces for a longer time, which increases the likelihood of exposure. So you all work at the Air Force Base, and so you have occupational exposure, some definitely more than others. So if you're in charge of fueling or aircraft maintenance or aircraft operation, you are going to have a higher level of exposure than somebody who isn't dealing with those aspects of the aircraft. And something to keep in mind in your occupational exposure is we're talking a lot about fumes and exhaust because that is the primary method of transfer and exposure. But it can also be absorbed by the skin. And so it can get on your clothes, on your skin, and then you can carry that with you throughout the rest of your day. So when you go home to your families or you are interacting in office spaces, you can be exposing them to that as well, which is definitely something to keep in mind. Even if you're not working directly with fuel, you can have incidental exposure as well. So again, contact with people who have been working with fuel, who have it on their clothes or on their skin, and then just inhalation of ambient fuel vapors. So you're on a base, there are planes taking off, there's going to be fuel vapor in the air that you'll just be inherently exposed to. So based on your exposures, we can kind of classify you into a group. So you can have a low exposure group, which means you're not getting any direct fuel contact. So that would be those of you that are military police, working in offices, not getting near planes at all, really. And then we can have the moderate exposure group, which would be people who are having regular contact with jet fuel. So the fuel handling, distribution, recovery, and testing. So kind of like these guys on this slide. And then finally, you can have the high exposure group, which will be fuel maintenance workers. So you can think right now about what your job is and kind of classify yourself into one of these groups, which will help you think about what kind of consequences and exposures you might have and how that could impact your life. Okay, so your exposure to benzene is like the main component of JP8 that is concerning. So benzene is a known carcinogen, but it also can have short-term consequences. So when you're very acutely exposed to benzene, inhale it, within hours, you're going to experience things like drowsiness, dizziness, an increased heart rate, maybe an irregular rhythm, headaches, tremors, some confusion, And if you're inhaling really high amounts of benzene, you can even have loss of consciousness or death. Now, there have been no lethal cases associated with JP8 exposure because the benzene levels are relatively regulated in that. However, it's still definitely something to keep in mind if you're ever starting to feel this way when you're working with your the jet fuel. You should take a step back for sure. And you can also have other short-term exposures that are going to be less acute. So that would be something that happens a few months into your job or after a few weeks. And something that's definitely an important aspect to keep in mind is that it will decrease your immune function. And this is an impact that will last a lot longer than the exposure. So you'll continue to have a decreased immune function. And so we know this because it will lower the mean corpuscular volume of your blood cells and the MCH, and then it will also increase the MCHC. And so all of this is just saying that your immune system will be weakened and you're going to have a little bit of anemia. Now, aside from short-term exposure, we can also have very long-term consequences to jet fuel exposure. So the primary thing that is most concerning is the effects on the hematopoietic system, which is your blood. So exposure to high levels of benzene or even low levels of benzene for a chronic amount of time, many years, 10 plus years, can cause bone marrow damage, aplastic anemia, or even leukemia. And those are all very serious, and so that's definitely something to be aware of. Additionally, you can have some neurological effects. So there has been research done recently that shows that inhalation of jet fuel can cause some vestibular and proprioception deficits, so some balance issues, swaying more, and this is all due to jet fuel exposure, specifically the inhaled jet fuel. There is also an effect seen on the reproductive system. So men, you guys are safe. There hasn't been any spermatotoxicity associated with jet fuel. However, women, you guys, it has shown that there can be an irregular period or a decrease in ovary size associated with high levels of JP8. And then finally, not surprisingly, your respiratory system is going to be impaired. If you are breathing in jet fuel all the time and in taking these fumes, these benzenes and naphthalene, it's going to impact your lungs. So this can present with coughing, chest tightness, breathlessness, and increased or decreased exercise tolerance. So all of these things would definitely impair with your quality of life. And so it's important to think about how we can maybe limit our exposure to jet fuel. So how can you limit your exposure? First of all, it's very important to always make sure you're following all of the standard Air Force protocols for dealing with jet fuel. You can maintain an adequate ventilation, so you make sure that you are working outside, you're wearing a mask, you're taking breaks. So we're gonna try to make sure that we're getting plenty of fresh air so that we're not just constantly breathing in those fumes. Additionally, it's important to recognize that you can have absorption through your skin of these fuels and these chemicals. So you should be wearing protective clothing, and you can shower or wash off if you get exposed on your skin to the jet fuel. Finally, you can limit your exposure to other sources of benzene. So cigarette smoke and diesel gas, all of these things have benzene in them, and that would further increase your exposure and further increase the likelihood of you developing any of these short or long-term consequences. I have some references here that are what I talked about, some of the research that supports these findings. And then I just have, if you have any questions, you can just ask them now. And if you have any other questions, feel free to contact me or the Arkansas Department of Health. And thank you very much.